You've heard me talking about this recently. You're going to hear me talking about it more in the days, weeks, and years to come, and that is the danger to hospitals in this country, specifically rural hospitals, more than anything else. Since 2005, a couple of hundred hospitals in America have closed. According to the National Rural Hospital Association, 600 are in trouble today, 200 more in imminent danger of closing soon. This has huge impact on millions of people in America. And in addition to that, as I've talked about, ambulance services are also going bankrupt in America. A guy who knows this well because he sees it up close, Paul Seegert, managing partner at PCS Advisors. Paul, good to have you back.
Thank you.
America is confronting a healthcare crisis, more so in rural areas, because what happens is these smaller hospitals don't have the finances to compete because the government keeps scaling back reimbursement rates, makes it tougher and tougher. Then you have big hospital systems that come in and they'll buy a rural hospital and then decide, well, we don't really want to keep that one open. We'll consolidate. Hospitals close. And it's not just the healthcare that goes away. It's the jobs that go away. It really is a 1-2 punch, isn't it?
It sure is. And we've allowed 1,500 of those mergers in the last 20 years. Somehow the government comes in and won't let two budget airlines merge in the last month, but they'll let it get to a point where you have 90% of our healthcare markets are highly concentrated. That's rural and urban, just meaning one health system pretty much runs the roost, and it always leads to higher prices. And so for the consumer, it's just not, but yet they continue to say, yes, we'll approve this merger because the hospital system pitch them on the fact that it's going to lead to efficiencies that can get passed on to the consumer. And it just doesn't.
But it doesn't. It leads to empty buildings and places. I've been all over this country. And you told me something else here that you can explain to the folks that I learned from you a few weeks ago. A disturbing number, and that is 51% of Americans now get some sort of health care subsidy from the government. And so the dirty little secret for my entire life and yours was that basically the big insurance companies were able to pay more than the people that couldn't pay, and hospital systems and healthcare systems would balance out the books, if you will, by charging the insurance companies more for a procedure than they probably should, right? And therefore charging people like me more for premiums than they should to balance out the system. But now that 51% are getting paid by the government, it means the system, it's upside down and it's not getting better.
Yeah, it's, to me, one of the most alarming things that's happened in our healthcare system in the last decade is the fact that through COVID, we ended up pushing more and more people into government programs, some of whom we created moral hazard and we pulled them off of their coverage at their job. They didn't all lose their jobs. Or we pulled them from other coverage that they had, and we put many, many millions, depends who you believe, 8 to 12 million more people on Medicaid. And that put us in a place where we have more than half of America getting their coverage through Medicare or Medicaid. That doesn't even count the folks that are getting a subsidy on the exchange and paying a portion of the premium, but maybe not all of the premium. And those plans don't reimburse providers enough to survive. And they continue to get reduced, as you mentioned. So you have these, especially rural or urban facilities that are in poorer areas that cannot survive on those reimbursements. They need 120 to 140% of many of those reimbursements that they get just to break even on a procedure. It's the same reason we see pediatric care. There's a shortage right now of pediatric beds in this country. Why? Because we've put a huge percentage of children on Medicaid, and those operate in the red. So they just decrease those beds quietly and put someone in there for a knee replacement or some other profitable procedure.
Right. One of the other things that gets eliminated, I've noticed, obstetrics. Hospitals will eliminate entire departments that aren't making them enough money. Obstetrics, you go to the hospital to have a baby. Well, not this hospital and not this hospital, not the one over there, because they just eliminate that stuff, don't they?
Yeah. 47% of rural community hospitals in 2020 didn't provide obstetric services anymore. I mean, that's incredible.
So where do you have a baby?
Now millions of people that have no access to maternity care.
And here's the other
drive
part of it.
a great distance.
Yeah, speaking of driving great distances, and Paul Seegert here, managing partner, PCS Advisors, he goes in and explains to companies how they can get better insurance coverage for less money. It's a consulting approach. But here's the other part that people aren't coming to terms with yet. If the hospital closes in your town, and usually these small communities also service a wider geographical area, a few counties oftentimes. Well, if the hospital is no longer 10 minutes away and it's now 45 minutes away or an hour, then just diagnostics, normal testing, things that would identify disease and illness in a timely fashion. People are like, well, I don't have time to take a day off from work or run all the way down. It used to be 10 minutes, and I got to drive an hour, and I got to sit there, and I have to take a day off from work, and I don't really want to. And as a result of that, people are getting sick and dying prematurely, aren't they?
That's a fact. Yep. We're discovering cancers later. We have people that have manageable chronic illnesses that are not getting cared for appropriately, not taking the right medications. You have diabetics that don't get the things that they need because we create healthcare deserts. And it's not, I think when you say rural, people assume we're talking about, 100,000 people out of our 300 million plus people. And it's actually about, depending how you define it, it's about 20% of our population that are served by these facilities.
Yeah. How do we turn the corner, Paul? I've been to places in Ohio and Tennessee and Missouri and Michigan where I've seen hospitals closing and the ambulance services are going bankrupt as fast as you can believe. And the thing is, nobody knows it because when you think about an ambulance, unless you work there, you don't think about it unless you need it. The hospital, you don't think about it unless you need it. And so people don't realize it's quietly going away, all of these things. The ambulance services are just going upside down, left and right. People don't see it.
That's a clue as to how our system would operate if we went to a single-payer model, because everyone that does the math to say that would be better and cheaper than what we have, and I'm not saying what we have is doing great on the payment side. We have a big problem there, obviously, that we're talking about. But the level of reimbursements is the issue. You can't have what has become the largest provider of health insurance in this country, the government, not paying enough to cover the cost of care. You can ask any CEO of a rural hospital, how could we fix this? They said, pay us what it costs plus a little bit more to provide care to people. You can't have a population of people that are customers that are largely Medicare, Medicaid, and uninsured, and then meaning some of those uninsured, you're going to have to write that off, and the Medicare and Medicaid, you can't make money on it. I mean, what are they supposed to do? Put it in provide healthcare in a tent? I mean,
well, it brings us to
it's so little known.
It brings us to what the Democrats said would never happen, but has always been inevitable, and that is, well, Mr. Gruber, you don't need that hip replacement. I mean, after all, look at your age. The actuarial table says you won't be here, in a few years.
Yeah.
And they're going to start rationing healthcare in America in a way that they called them death panels. We'll never have death panels. Of course we will. Of course we will. Won't we, Paul?
Yep. Yeah, if you look across the pond right now into the UK, higher quality employers are beginning to offer health insurance to attract employees because people are waiting so long to get care. I mean, you could be having a stroke and you might wait 90 minutes for a hospital to send an ambulance, and the hospital's 5 blocks away. And that's not an exaggeration. That's happening every day. And you might have to wait months for chemotherapy. You might have to wait months to get an MRI. So they're stepping in with private insurance to cover that for those with good employment. And
the problem is
you can only ration things by line or price. Line would not be very attractive to the American consumer. We're not used to that.
No, but the problem is we can identify the problems. Solutions are few and far between. I'll give you the last word.
They are, because it's much easier to stand up and talk about things that they know won't work, politicians, I mean, than to actually stand up and say, hey, we've been underfunding this program and we've been mismanaging this whole thing for a long time. We've got to really sit down and come to the table and fix it. And that is going to require more funding. You can't just continually, in our world, fund Medicaid and Medicare, decrease these reimbursements. That doesn't make any kind of sense. But when you have 14 or 15 lobbyists for every member of Congress to keep things the way they are, change is difficult.
Paul Seegert, Managing Partner, PCS Advisors. Paul, always an education. Not sure I enjoy it, but it is an education. Thank you for being here.
Thanks for having me.